Optic neuritis. Optic nerve disease, inflammatory, vascular, or degenerative, hindering nerve conduction and inducing decrease in visual acuity and field of vision. Inflammatory neuritis. This occurs by direct spread from neighboring structures, as perineuritis, meningitis, orbital and nasal sinus infection. Intraocular inflammation, as uveitis, retinitis, endophthalmitis, sarcoidosis, and sympathetic ophthalmia. Ischemic optic neuropathy. Vascular insult occurs as in arteriosclerosis, hypertension, diabetes, collagen vascular diseases, giant cell arthritis, and Takayasu's disease, pulseless disease. Ischemic optic neuropathy is also caused by rapid elevation in intraocular pressure. Acute glaucoma results in abrupt rise in prelaminar pressure and disc edema. Rapid elevation of intraocular pressure results in decrease in perfusion of posterior ciliaries. Another cause is systemic arterial hypotension, as in shock and myocardial infarction. Blood diseases causing ischemic optic neuropathy include polycythemia, sickle cell disease, leukemia, and thrombocytopenic purpura. Optic nerve compression may cause ischemic optic neuropathy as well, as in peripapillary malignant melanoma, optic nerve glioma, meningioma, orbital tumors, and optic nerve diseases. Degenerative optic neuritis. This is caused by demyelinating diseases as multiple sclerosis, acute disseminated encephalomyelitis, Divix neuromyelitis optica, Childers diffuse cerebral sclerosis. Toxic optic neuropathy, caused by tobacco or ethyl alcohol toxicity, methyl alcohol toxicity, lead poisoning, and drug toxicity. Systemic diseases causing degenerative optic neuritis include sarcoidosis, blood disorders, collagen diseases, endocrinal disorders as hyperthyroidism, diabetes mellitus, malignancy, allergy, and starvation. Classification of optic neuritis. Ophthalmoscopic classification. Retrobulbar neuritis, pathologic affection of the optic nerve behind the globe sparing the intraocular portion. Optic disc appears normal. There is marked multifocal impairment. Papillitis. Optic disc is swollen and hyperemic with dilated congested vessels and blurred indistinct margins. Neuroretinitis, papillitis plus retinal involvement. Topographic classification. Perineuritis, involvement of leptomeninges around the nerve, secondary to an extension from adjacent orbital or ocular structures. Periaxial neuritis, involvement of peripheral portion of the nerve, secondary to spread from leptomeninges. Axial neuritis, involvement of the central portion of the optic nerve. Transverse neuritis, complete massive cross-sectional destruction. Patchy neuritis, random foci of optic nerve involvement without specific topographic orientation. Optic atrophy. This is loss of the conductive function of the optic nerve, with increasing pallor of the disc, secondary to gliosis and loss of optic disc capillaries. This is the end result of progressive nerve insult. In optic atrophy, there is shrinkage of parenchyma. Redundant dura and widened subarachnoid space are also present. Microscopically, there is loss of axons, loss of myelin sheaths, glial cells proliferation, thickening of pile septa, widening and deepening of physiological cup. Pathology. Types of optic atrophy. Primary descending optic atrophy. The lesion is in orbit or central nervous system. Secondary or ascending optic atrophy. Primary lesion in retina or disc. Schnabel's cavernous optic atrophy follows acute rise in intraocular pressure and anterior ischemic optic neuropathy. Retrolaminar cavernous spaces contain hyaluronic acid, which could be from vitreous. No gliosis or histiocytic reaction is present. Now we'll check the differences between various types of optic atrophy. Primary optic atrophy, as in disseminated sclerosis, tabes dorsalis, tumor compression, severe blood loss, and trauma. The disc is milky white. The edge is well defined with enlarged cup. The lamina is thin, Vessels and retina are normal. Secondary optic atrophy, postpapillodemic or postpapillitic. The disc is gray-white with irregular edge, obliterated cup. The lamina is not seen and bulges forward. Vessels are sheathed and retina is normal. Consecutive optic atrophy. It occurs after retinal diseases as central retinal artery occlusion, retinitis pigmentosa, high myopia, amaurotic family idiocy. The disc is waxy yellow with irregular edge and obliterated cup. Lamina is not seen. Vessels are attenuated and retina shows the etiology. Postglucomatous optic atrophy. It occurs in end-stage glaucoma. The disc is pale white. The edge is well defined and the cup is deep and large. Lamina seen. Vessels are interrupted and retina shows tigroid fundus and myopic changes.